Hello and welcome. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Song Brown Primary Care Residency Program informational webinar. Let's start by looking at who this webinar is for. This webinar is for new and continuing applicants to the Song Brown Primary Care Residency Program. You'll hear us refer to that as Song Brown PCR. The PCR program provides grant opportunities that will result in funding organizations to educate and train primary care providers to work in underserved communities. And Song Brown is administered at the state level by HCAI. Let's jump now to today's agenda, see what's coming up. I'm going to do the introduction and housekeeping, and from there, we'll have John join us to do the program updates, application process, and requirements. And then at the end of that, we will have a question and answer session, which we will let you guys ask all the questions that you have. Before we begin, I'd like to discuss a few housekeeping items. First off, this webinar is hosted in Microsoft Teams. If you're not familiar with that platform, you can find the chat and the view controls in the menu bar at the top of your screens. As I said, the chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. And we are recording this webinar today, and it will be available on our website within 7 to 10 business days. And now with that, it is my pleasure to introduce John Nguyen, Program Officer for Song Brown PCR, to get us started. John.
All right. Well, thanks, Chris. Thanks for the introduction. I really appreciate that. Like Chris said, I am a program officer for Song Brown. Fairly new. Just want to let you guys know that, and let's just dive right in. So about our program, Song Brown. Song Brown provides funding to education programs, including primary care, family nurse practitioners and physician assistants, registered nurses, and midwifery programs. Song Brown also provides financial incentives to programs to graduate individuals who practice in medically underserved areas, enroll members of underrepresented groups in medicine to the program, locate the program's main training site in a medically underserved area, or operate a main training site at which the majority of the patients are Medi-Cal recipients. Some dates that are important that I would like to mention today is that currently our e-app registration is now open. You're welcome to go and try to set up an account right now if you would like. Our application release date was on July 25th, 2025. Our early submission review is August 27th, 2025. And our application deadline, very important here, is September 8th, 2025 at 3 p.m. Now, before you apply, if your program requires approval to contract from a coordinating authority, inform the authority of terms and conditions contained in the grant agreement. Applicants must agree to the terms and conditions as outlined in the grant guide before receiving funds. HCAI will not make any changes to terms and conditions specified in the grant agreement. Funding shall be used to expand primary care services, and funds shall not supplant existing federal, state, or local funds to provide primary care services. Some notable changes that I'd like to mention is that the import feature has been removed from our program. Applicants can no longer copy over training sites and graduates from previous applications. Another thing that I'd like to note is that the underrepresented in medicine URM residents and URM graduates will no longer be scored. You must, however, still provide the information for data collection purposes. So let's just begin for some of the information to gather prior to applying for our programs in existing, expansion, and teaching health center, which we like to abbreviate as THC, is to include the correct organization name and address. This is very important here. The legal name for your organization must match the address on file with the IRS. Incorrect information can delay the agreement process. Grant agreement and payee data record, STD 204 signatories, facility type for each primary continuity clinic training site, the payer mix information for each listed primary continuity clinic, and the race or ethnicity data for all current residents. Some more information to gather for our existing expansion in THC is our current practice site information for all graduates entered, the national provider identification number for all graduates entered, and the applicable required attachments for the ACGME accreditation or ACGME expansion letter. And lastly, it's permission from your organization to apply for the grant. To continue, for information to gather for our new programs, it's very similar to our previous three mentioned, is the correct organization name and address. Again, I'd like to emphasize that the legal name for your organization must match the address on file with the IRS. Incorrect information can delay the agreement process. Grant agreement and payee data record STD 204 signatories, facility type for each primary continuity clinic training site, and payer mix information for each listed primary continuity clinic. Some required documents for our new program is when we gather information for phases and applicable required attachments. Each phase from A through D will require an attachment at time of application. This includes A, institution affiliation sponsor letter or proof of application, B, a fiscal plan, C, a timeline in place, and D, training sites recruited. If phases D through G are selected, only a letter of sustainability is required. Some of the program funding categories that we have in our program is currently existing primary care residency programs are existing, our teaching health center, which is THC, and our new primary care residency slots for existing programs expansion. You notice in the slides that there is a lot more information here on the right that you can refer to. I just want to note that 24 to 48 hours from now that this presentation will be posted so you can refer back to it. This information can also be found in our grant guide and our TA guide. Some of more programs that are funded in our program is the new primary care residency program and our new primary care residency programs with a match. Again, there is more information on the right here on the slide that you can refer back to. Now, the available funding for each program is listed here in greater detail and includes the nominal amount. Currently, with our award categories, existing slots maintain 8.6 million. Teaching health centers is 5.6 million. Expansion slots are 3.3 million. New programs are 3.3 million. And so total, our program offers up to $31 million in funding. Some helpful resources are included here as a link. You can click on it afterwards when you're given this presentation. It includes the Song Brown glossary and the PCR grant guide. Now I'd like to dive into our e-application, e-app registration. When creating an account, please select the Apply to HCAI funding. Click the button Sign in or Register. If you are a new applicant, please register now. Please do not wait. When creating an account, our funding portal has a two-step authentication process for new applicants when setting up their account. When clicking the funding portal link, Apply to HCAI funding, make sure to select Sign Up Now link and enter the information as requested to receive a verification code via email. Now, when you're setting up your profile, please make sure to check the organization for healthcare workforce support box to gain access to Song Brown PCR applications. Please ensure that you do not check the healthcare professional box. Click the magnifying glass to search for a pre-existing organization. Click Request New Organization to submit a new organization for approval. And that obviously is for the folks that are just submitting for the first time. Once you have selected or submitted an organization, it will populate the search field. Just please note that most organizations are in the system already. Use the search function before submitting a new organization name for approval. Now, while you're adding a new organization, please ensure that you enter the organization name and then you click the Select Address button. A new window will pop and allow you to enter and search for an address. Now, just click on the confirmed address and it will populate the address fields on the page. Please note that a Song Brown staff will review the new organization request within 5 business days. Ensure the organization name is accurate. During this time, you may still begin an application. Now, when you're completing your profile, please enter all required fields. When you're done, please click the Save button. If there are no errors on the page, you will receive a message stating your profile has been updated successfully. Please note incomplete information may delay your registration. Now, when you are creating a new account, and let's say you have a newly created account are assigned to, all newly created accounts are assigned the grant preparer role. If you are the residency program director, however, please email us at songbrown@hci.ca.gov to request the program director role. We will be able to assign that to you. Now, it's important because only accounts with the program director role may initiate and submit applications. Once Song Brown staff approves your request, you will receive a follow-up email confirming the approval. Please note, program directors may initiate, view, edit, submit applications, payment certifications, and final reports. And on the other hand, grant preparers are limited to viewing, editing applications, and submitting payment certifications. Now, as a program director, you have the ability to assign other users. They have an additional tab on their profile page called Assign Other Users. Navigating this page from your profile page allows you to add users who can view and edit applications only. Click the Add User button to give registered grant preparers access to your applications. Please note, only program directors can submit a completed application. Now, when you hit here, when you apply here to navigate to the Apply Here page on the main menu, select the Song Brown Primary Care Residency 2025 link and click the Apply button when you are ready to begin. Now we're going to go over some helpful tips. Some useful information prior to starting the whole application. There's some simple things like navigating the application. Use the previous and save and next buttons found at the bottom left of each page. You can see that on the slide here. Also, saving your application each time you click save and next is the application process. In the application, your progress is saved. Navigate to the applications in progress/submitted page to resume your application. More useful information here is that anytime that there's a field with an asterisk, as shown here in the slide, it's a red little star. It basically tells you that you will not be able to proceed to the next page unless you fill out this box. It is a required field. Some cool things is that that will appear are these little question mark blue circles. You can click on it to see a tooltip, basically giving you additional information on how you can either fill in that box or what it's there for, maybe some examples. But yeah, if you're curious, you could just click the box. Circle, sorry. Now, let's just start diving into starting the application. Some program information. Your program information will pre-populate with information you entered in your profile page. Select the program type you want to apply for. Select a residency program title from a list of training programs by clicking on the magnifying glass. If your residency program is not listed, check the box Residency Program Not Listed. Please note that most residency programs are in the system unless they are new. Use the search function before submitting a new training program name for approval. Now for the program information address. After checking the residency program not listed box, new fields will pop and appear below. Excuse me. Type in the program name under residency program title. Click the plus select address button. A new window opens and allows you to enter and search for an address. Click the confirmed address and it will auto-populate the address fields on the page. Please note that you will see this address validation feature throughout the application for your convenience and for accuracy. Some more program information. It's a award category. Select the award category that you are applying for. Please note that you can apply for multiple funding categories in one application. However, if you are applying for any new program funding, you cannot apply for any other categories. So now we're going to dive in to the PCR new programs. An overview of new programs and new programs with match. Phase A is mandatory to receive any type of new programs funding. The phases you have completed ultimately determines which new program funding you are eligible to apply for. Please note a program may not apply for THC, existing, or expansion funding if applying for any new PCR programs funding during the same cycle. Now, determining eligibility for new programs. Let's say your agency has received sponsoring institution accreditation or will have applied for sponsoring institution accreditation by time of annual PCR application release. You have obtained residency program accreditation and have no first year residence at the time of application and has not received any prior Song Brown funding. You have completed phases A through D. If yes to A through D, you may apply for new programs funding. Now, to determine eligibility for new programs with the match, in process of applying for or has, if your agency is in the process of applying for or has already received sponsoring institution accreditation, has not received any prior Song Brown funding, in the process of completing or has completed phases A through C, you have not yet completed phases D through G, and that you are willing to match 25% of your organization's funds toward HCAI's total award. If yes to A through C, you may apply for new programs with a match funding. Now, how new programs with a match and how it works is there's a prime example here in the table shown. Let's say HCAI grants an award amount of $2 million. You are willing to match that grant at 25%, which is $500,000, which increases your total, which makes your total budget to $2.5 million. Okay, next we're going to dive into the PCR new program application. So the program information for new program, please just click new program over here, check the box. After completing this, click save and next. Now for the contract administration page, please include the contract and organization name, and doing business as DBA must match what you report to the IRS. That part is very important, and not having that information correct will delay your application process. Number two, please select the type of entity, must identify the contract or organization as governmental entity or non-governmental entity. Three, you want your grant agreement signatory must be an individual with authority to enter into a grant agreement. The STD 204 signatory must be an authorized signatory. Please note, if you are confused or have questions on who this person may be, please verify this information with your finance or contracts office to ensure this information is correct. Providing incorrect information will delay your grant agreement should you be awarded. And lastly, please note that there is a PO box option available for the 204 category. Some further program data, please review. We're going to review the ACGME accreditation phases, A through G, and select the response that best describes the status of each phase listed. Selecting yes to phases A, B, or C, no to phases D through G, and being willing to match 25% makes you eligible for up to $2 million in funding, new programs with match. Selecting yes to phases A through D makes you eligible for up to $1 million in funding, new programs, no match required. So we're going to continue with some more program data. For new programs with match, supporting documentation is required at time of application for each phase answered with yes. For new programs, only a letter of sustainability is required at the time of application if all phases are answered with yes. For training sites, select yes to phase D. It will require you to fill out training site information on the next page. To add a primary outpatient training site or sites, click the Add a Site button. A pop-up window will display. Complete all required fields as shown. Please note that we only need primary outpatient training sites, not every single site. So for the training facility type, select the facility type of your training site. Please note, please verify your facility type by using the links provided. Use only these links to identify. They are listed here. And please note, only indicate a facility type that can be found. So the training site's payer mix, complete all required fields, provide payer mix information for the last 12 months, and after completing this page, click the Submit button. Please note payer mix is required for all listed training sites. Payer mix does not have to equal 100, but must be in whole numbers only, please. So training sites for the editing portion. To edit or delete individual entries, click the down arrow button next to the desired entry, as shown here on the slide. This menu gives you the option to edit or delete each individual entry. After completing this page, please click Save and Next. Okay, so for strategy questions 1 through 5, please indicate which strategies you plan to use in the development of your program. Provide responses for each strategy questions 1 through 5. Multiple responses can be selected per strategy question, but each selected strategy question will prompt a narrative for further explanation. After completing each page, click Save and Next. For residency training, indicate how many first-year residents will you initially be accredited for or plan to be accredited for. Select if your residents will train side by side with F&P and or PAs. Some of the expected expenditures, please provide how much funding you are requested based on your expected expenditures and what you are eligible to apply for. Please include the maximum funding requested for new programs is 1 million. Maximum funding requested for new programs with match is 2 million. Yes, and at that point, you can click Save and Next when completed. So new programs with match budget/funding. New programs with match applicants will have to complete an additional table. It's the budget funding table. Provide your anticipated or actual expenses related to each budget category listed. Separate your costs into the respective phases. After that, you can click Save and Next once you completed all these sections. There are going to be some required documents, and you have to upload it in this manner. Number one, files uploaded must include prefix. Here is shown an example with that prefix right there. Save your document using the prefix indicated prior to uploading. The red buttons on this page indicate required documents based on your phase responses. Now, after that portion is done, click on the red button to upload the required documents. We're going to continue with some more required documents. Once you upload all required documents, the buttons turn green, signifying that you may continue. Uploads may take up to 15 minutes, so be patient. To delete a document, however, click the down arrow and choose Delete. Click Next to take you to the final page of the application. Some assurances, please read the statement, agree to the statement box by checking the box, click the Submit button. Please note, once you submit your application, you cannot make further details. So please make sure that you make all your edits prior to submitting. And also note that only program directors may submit an application. Grant preparers will not see the Submit button. They can assist you in editing the application, but they cannot submit if you, as a program director, plan to be away during that time. Okay, now if you have successfully gone through all the steps that we just went over, you're going to come to this screen right here. It's going to be submission completed, and you're going to be given an application of your number, and you're going to be seeing this page here. Well, after that, once you submitted your application, you can view and print your application by selecting the options dropdown on the application's in progress/submitted page. Okay, all right. So we're going to get into some of more details in regards to the primary care residency existing slots for the teaching health center, um, existing and expansion slots for applications. So some program information for the existing THC and expansion. Please provide all requested information. As you know, very similar to the ones that we mentioned before. Use the magnifying glass search function to select the residency program title from the list. After checking the box next to the desired award category, additional fields will populate. And again, after completing this page, please click and save next. For the contract administration page, again, like to say, very important here, the contract organization name and doing business as DBA must match what you report to the IRS. Can't stress that enough. Please include that. Make sure that it's accurate and up to date. Please select the type of entity. So identify the contractor as governmental or non-governmental. Again, please make sure that the grant agreement signatory is an individual from your agency that has the authority to enter into this grant agreement. And lastly, the 204 signatory must be an authorized signatory. Again, please verify with your finance or contracts office to ensure this information is correct. Providing information that is incorrect will delay your application. And lastly, if you are using a PO box, that option is available in the 204 category. Some program data, please complete all required fields as shown here. Having resident and graduate data to report will allow additional fields to appear for you to complete further into the application. Add all requested training sites, resident, and graduate data as instructed on each page. Some continuity training sites. To add a training site, click the Add a Site button. A pop-up window will display. Complete all required fields as shown here in the slide. Okay, so the continuity training sites, facility type, again, please just select the facility type of your training site. Verify your facility type by using the links provided. Use only these provided resources to identify the training sites that are approved below. So for the continuity training sites payer mix, please make sure to complete all required fields. Payer mix information is asking to provide a percentage of the last 12 months. After completing this page, click the Submit button. Please note, payer mix is required for all listed training sites. Payer mix does not have to equal 100, but must be in whole numbers only. So for continuity training sites, for the editing portion, to edit or delete individual entries, click down the arrow button here as shown on the slide next to the desired entry. This menu will give you the option to delete or edit the individual that you have entered. Once you're complete with this page, please click Save and Next. Now we're going to dive into the executive summary. This portion of the application, you're going to provide a requested executive summary and program description information. You have a maximum limit of 2,500 characters. After completing this page, click Save and proceed by clicking Save and Next. Please note, if you exceed the character limit, you will receive a pop-up message. If you copy and paste text from another document, text may not transpose over properly, so please double check the information you entered and make sure everything is captured so that we have an idea of the description of your program. So funding and expenditures. Funding and expenditures are based on what funding category you're applying for. Please provide the number of slots requested for each funding category. If you are applying for THC and existing funding, ensure your slots do not exceed your program's total number of approved first-year slots. Annual expenditures for the last academic year is required for all programs except new programs. Please note, you do not need to enter information into the grayed out fields. These fields will auto-populate with information. Now we continue with the funding and expenditures. Please complete all required fields shown if applying for THC funding, as shown here. The total program annual budget must be equal to or more than total requested THC Song Brown funding. Please make sure you're aware of that. And lastly, just after you're complete with this page, just like the other pages, please click Save and Next. So we're gonna go into the portion where you are adding aggregate resident data. The resident race ethnicity data is now collected in aggregate for all the years requested. Provide the total number of ACGME approved slots for each academic year. Please note the aggregate resident data page replaces the prior year's resident data page. We are no longer collecting this information at the resident level. Please also notate that the total number of filled positions must match the total number of race/ethnicities of all residents. To continue with the graduate data, please enter in graduate data before adding each graduate. Graduate data needs to match the number of graduates entered. To add graduate data, click Add a Graduate button, as shown here on the left. A window will pop up and will display. To edit or delete each individual entry, click the down arrow, as previously mentioned, next to the desired entry. After completing this page, check the box to confirm, then click Save and Next. So now we're going to look at the portion where we're adding the facility type. Please select your facility type and complete the following information. Please note to verify your facility type by using the links provided. Again, I want to emphasize that please to only use these provided resources to identify the below facility types. Some common application errors that we received throughout the years. Let's just go over them right now. Applicant did not enter any data for residents or graduates, even though the applicant has residents and or graduates. The applicant enters practice site name and address for out-of-state graduates. This information is only needed for graduates practicing in California. Applicant did not provide the correct contract organization name. This name needs to match what is reported to the IRS, basically what is shown on your W-9. The applicant did not provide the correct grantee and 204 signatories or information is correct. Again, I want to emphasize that if you are confused on who that person is, please contact your contracts or your finance department to figure out who is authorized to do that. Lastly, applicant added a training program and did not search for previously used training program. Okay, let's continue with some required documents. Please, with the files uploaded, you must include the prefix included here, the ACCR underscore. Save your document using the prefix indicating prior to uploading. The red buttons on this page indicate required documents. Depending on funding type, you will upload specified documents. Click on the red button to upload the required document. Okay. Once you upload all required documents, the button will turn green here, showing on the left. You may signifying that you may continue. Uploads may take up to 15 minutes, so please be patient, okay? To delete a document, however, click the arrow button, as previously mentioned, to bring a selection of drop-down options to click delete, okay? And lastly, to ensure that you save your information and you're continuing with your application, please always remember to click Save and Next. Okay, some assurances at the end. Just read the statement, agree to the statement by checking the box, click the submit button. Please note, once you submit your application, you cannot make any further details. And please note also, lastly, to emphasize, only program directors may submit an application. The submit button will not appear for grant preparers. So please make sure that you go through all the application and you make sure that all the information is accurate. And ensure that it is ready for us to review, okay? lastly, if you successfully completed an application, you will see this screen. You will see the application number that you can refer to. And if you have any questions at all in regards to your application, you can refer this number to us so we can identify which one that quickly of which one you're referring to. Okay, and once you submit your application, you can view and print your application by selecting the options drop-down menu on the application in progress/submitted page. Okay, and then like I guess this portion, I would like to turn it over to Chris, and we're going to start the questions and answers.
All right, thank you so much, John. As you can see, our team has put a lot of work into this program, and we're excited that you've joined us today to learn more. We are going to transition to our question and answer session. In the menu bar at the top of your screen, you can find the button to access the chat feature, where you can type your questions in the chat. We do ask that you type your questions in the chat, not use the hand raise feature. That way we get a recording of your questions for us to be able to refer back to. We'll do our best to answer as many questions as we can in the time that we have together. We do ask, though, that if you have questions that are very specific to personal circumstances, that you email our team at songbrown@hci.ca.gov. We'll put that in the chat so that we can best assist you. So, all right, well, let's go ahead and jump into our questions today. And you can see in the chat that we've posted the resources there for you as well. You can access the primary care residency webpage. You can access the grant guide, the TA guide. There's a reminder of the dates that are available there for you, and also the songbrown@hci.ca.gov email address for you. All right, well, we're got to see message. It's possible that some people might not be able to access the chat. Want to make sure everybody can access the chat today. Normally that's not an issue for most people. So if somebody could enter at least something into the chat, let us know that you guys are there with us. That would be helpful. There we go. Bobby, they appreciate you putting a message in there, make sure that we know it's working. All right, fantastic. Well, we're here. We've got about 20 minutes. And Miguel, fantastic. Thank you for the question. Our IM program was awarded HRSA THC award in December. However, due to budget cuts, we did not receive funding. We have the NOA from HRSA. Should we apply as an existing program or a THC?
Hi, Miguel. Thank you. That was a great question. I highly encourage you just to apply for both.
All right. Let's see. Next question is, why is URM data no longer scored?
Joanne, thank you for your question. Currently, our legal office is reviewing that right now, and we're reviewing if it aligns with Prop 209. So
All
once
right.
that has been done, we'll be able to give you a better answer.
All right, fantastic. Thank you. Let's see. Next question. What is the purpose of the early submission review? Does the HCAI team review applications and provide suggestions for improvement?
And we So for early submission, we are primarily looking for completeness. And if there's anything that we're able to identify early, we will be able to reach out to you and request that information to streamline your process.
All right, thank you. Next question, if we have an existing login credential to access our utilization reports, can we use the same login for the application portal?
Thank you for your question, Con. If the login credentials are identical to the ones you use to access our portal, then yes, you can use the same login for the application portal.
All right. Next question here. Wanted to clarify item A on slide 13 regarding the required documents for new programs. Is the proof of ACGME application just the application itself, or do we also need confirmation from the ACGME confirming application initiation?
Thank you for your question. For phase A, we need proof of accreditation that you have applied. I'm sorry. I need proof that you have applied for accreditation.
All right, thank you. Let's see. Amanda asks, can application questions be previewed so that preparers know and collect the needed information before completing the application?
To them or not.
Amanda, thank you for your question. Currently, we're not sure if we can supply that information, so we will have to get back to you on that question, okay?
All right, thank you for that question, Amanda. We've got about 15 minutes left in our webinar today, and so we got plenty of time to answer all your questions. Go ahead and enter those into the chat as you can. Want to remind you that we are recording this webinar, and we also recorded the earlier webinar from today, and we will be posting both of those on our website within 7 to 10 business days. So you'll be able to go back and review both the content and the questions that were answered in both sessions through those recordings. And as you guys are thinking of any questions that you have, also wanted to remind you that we do have posted in the chat the primary care residency webpage, the grant guide, and the TA guide. Make sure that everybody's aware of those application dates. Early submission again is on August 27th, 2025 at 3 p.m. And then the program application does close September 8th at 3 p.m. All right, next question. Can a PD assign multiple grant preparers on the same application?
Great question. Yes.
All right. Yeah, multiple preparers, but only one person gets to hit send, right, John? Yep. Okay. If our PD has changed since the last application cycle, do we email you to update it? It's a great question.
Thanks for the question, Emily. Yes, please contact us as soon as possible so that we can make sure and ensure that the information provided is the most current and that the person is eligible for that position. Thank you.
All right, thanks, Emily. You can go ahead and use that songbrown at hci.ca.gov to be able to get a hold of us to let us know. All right, well, we appreciate everybody's interaction with us today. We've got still got plenty of time if you have more questions. Next question. Why did you remove the previous data on the graduates? I believe this question is referring to the import feature.
Okay, so we removed the import feature because we noticed that a lot of applicants were not not completing that portion correctly. And that we just want to ensure that the information provided is the most current and up to date.
All right, Kelly, thank you for that question. I definitely want to encourage you if you haven't yet. I'm sure most of you have, but if you haven't got a chance yet, really make sure that you get in and read both the grant guide and the TA guide. Those are going to answer probably most all of the questions that you have, but we know that there's always questions that do come up. One of the reasons why we do these webinars, but also, again, we have that email address that you can get a hold of us. So if later today you realize, wait a minute, I had a question and I forgot to answer it or ask it, don't worry. You can always reach us at that Song Brown email address that we've given you. All right, well, I'm going to give about 30 more seconds for any questions to come in before we move on to our webinar closeout. We do appreciate everybody taking the time to be with us here today. And again, we will be posting the recording of this and this morning's session in about 7 to 10 business days. We will have that on our website, and you can find that link in the chat. It will be the Song Brown PCR webpage. You will find that down in the resources section, again, in about 7 to 10 business days. All right, well, it looks like there are no more questions coming in. So I want to thank you all for your participation in the Q&A session today. We do appreciate your participation and all of your questions. We hope that you got all of your answers that you need today, but if you didn't, again, please email us at songbrown@hci.ca.gov. We do appreciate everybody joining to learn more about our Song Brown Primary Care Residency Program. This is just one of many health workforce development efforts that we have at HCAI, and we're excited to be able to offer, and we're grateful for your participation with us today. Just want to remind you that the application period does close on September 8th at 3 p.m., so don't wait to get those applications in. Did want to leave you with a few resource slides at the end here as we close out for the day. First off, if you aren't familiar with all of the other programs that we have, please go check out our website and look for the Workforce tab, and you'll see all of the great programs that we have for health workforce development. Also, in particular, if you're one of our awardees, we would love for you to not only follow us on social media, but post all of the great work that you're doing. Use one of these hashtags to let us know the successes that you're having, and we really appreciate seeing everybody interact with us online through our social media resources. And one of the best ways that you can stay up to date with what's happening at Health Workforce Development is for you to sign up to our monthly newsletter. You can go to the website here at the top of the slide. And if you, as you're signing up, you'll see some subscription options. Any of the subscription options under Health Workforce will get you added to our monthly newsletter. And it's one thing that we love to send to you every month so that you know what's coming up and what's going on. You can always contact us by phone or email. Again, preferred method would be to email songbrown@hci.ca.gov. We'll be able to get the help that you need. Thank you so much for attending today. And with that, we do conclude today's webinar. We hope you have a wonderful day.